But I don't think that helps anyone. There's a lot of like
Sorry, the coaching doesn't help, or
no
the
no
activities?
being put into a mental health hospital.
Mm-hmm.
It doesn't help anyone. It made me worse. Like I said, it was a very intense, scary environment.
Mm-hmm.
And then so the whole thing is you don't want to go back there because it's terrible.
Mm-hmm.
And so for like a while after, the doctors be like, "How you doing?"
Mm-hmm.
And I would say, "I'm good," so I'd have to go back there. But the way they see it on their like sheets on their system is Jack was bad. He went to hospital. Now Jack says he's good.
Mm-hmm.
So it looks like it works.
On paper, it looks it looks great.
Yeah, yeah, but it doesn't. It's really bad. And I think there's something that I ask you when you have poor mental health. Do you feel like you want to hurt yourself? Do you feel like you want to hurt anyone else? And I think if I was in a position of power in the health industry, like in the government, the first thing I'd do at mental health hospitals is divide the patients into two. One, those who are at risk to themselves. One, those who are at risk to others. Because there's some people in there that are just really depressed and feel suicidal. And then there's these people that want to start on everyone.
And mixing them is not necessarily is not healthy.
No, it's really bad, yeah.
Why do you think they're missing this? Because on paper it looks like it's working. Because on paper on paper it looks like you went there and now you're fixed.
Yeah, like that. I think it's just like it's difficult. Like all the staff there, right? That's a really tough job, right? They're there because they want to be there and they want to help and they want to make a difference.
And so she lost so much connection at a really important moment of development.
Yeah.
And I can see that now having an effect.
Yeah.
And it's not just her. I can see so many children of her age having lost connection at a turning point, an important moment in their life. And that effect, I don't think we're even beginning to feel it. I think there's going to be some struggles for years to come. And I think if there's ever a moment like COVID again, I think the worst thing that we can do is lock our children down.
One of the things that I likened COVID to, in a sense of the magnitude of the effect, is sort of like the world wars.
Yes.